Growing older is an inevitable part of life, and with it comes important decisions about where and how we will live in our later years. One of the biggest choices many elderly people face is whether to move into a nursing home. At first glance, this option seems safe and convenient, offering professional care in a structured environment. But is it truly the best choice? In this video, we'll explore the reality of life in a nursing home, the benefits, the challenges, and the unexpected consequences that many people don't consider. If you or a loved one are thinking about this transition, stay with us until the end. Understanding all aspects of this decision can help you make the right choice for a happy and fulfilling life. Professional medical care. One of the biggest reasons people choose nursing homes is the availability of professional medical care. As we age, health concerns become more frequent, and having trained staff available 24/7 can provide a sense of security. Nurses and caregivers are always on hand to monitor health conditions, administer medications, and respond to emergencies. For those with serious illnesses or mobility issues, nursing homes offer structured care that can be difficult to manage at home. Specialized services like physical therapy, memory care, and rehabilitation programs can improve quality of life. However, it's important to consider the limitations. While nursing homes provide medical support, the level of personal attention varies. Some facilities may be understaffed, leading to long wait times for assistance. Additionally, standardized care routines may not always align with individual needs and preferences. So while professional care is a strong advantage, it's crucial to evaluate whether a nursing home is the best setting for your specific health requirements. Loneliness and lack of connection. One of the hardest realities of moving into a nursing home is the feeling of loneliness. Many people assume they will have plenty of social interaction with other residents, but the truth is that adjusting to a new environment can be isolating. At home, elderly individuals are surrounded by familiar places, family members, and community connections. In a nursing home, their world shrinks. Family visits may become less frequent over time as loved ones get caught up in their busy lives. Many residents find themselves spending hours alone, waiting for a visit or a call that may never come. Additionally, while nursing homes offer group activities, they don't always create deep, meaningful connections. Some residents struggle to relate to others, especially if they have different interests or health conditions. Before making the decision to move into a nursing home, ask yourself, are you prepared for the possibility of feeling isolated? Staying socially engaged is just as important as receiving medical care, and a lack of connection can have serious effects on mental and emotional well-being. Loss of independence and decision-making. Moving into a nursing home isn't just about changing where you live. It also means giving up a level of control over your daily life. At home, you decide when to wake up, what to eat, and how to spend your time. But in a nursing home, most things follow a schedule set by the facility. Meals are served at specific times whether you're hungry or not. Activities are planned for groups, not tailored to personal interests. Even something as simple as going outside might require permission or assistance. Over time, this loss of independence can be frustrating and disheartening. Many elderly individuals find themselves adapting to the system rather than living life on their own terms. They stop making decisions for themselves and instead follow the rules of the facility. This can lead to a feeling of helplessness, making it even harder to regain independence later on. Before choosing a nursing home, ask yourself, are you willing to give up the small freedoms that make life truly yours? Because once they are gone, getting them back isn't easy. Living environment and comfort. A home is more than just a place. It's a space filled with memories, personal belongings, and a sense of security. Moving into a nursing home often means downsizing to a small room with limited space for personal items. This transition can be emotionally challenging, as many people feel like they are losing a part of themselves. Nursing homes are designed for practicality, not necessarily for comfort. Rooms may feel sterile, with minimal decoration and little opportunity for customization. Some facilities offer private rooms, but many residents have to share spaces with strangers, which can lead to conflicts or discomfort. Beyond the physical environment, there is also the issue of privacy. Staff members frequently enter rooms for routine checks, medical needs, or assistance, making it difficult to have personal time. Simple activities like showering or dressing may require help, which can be an uncomfortable adjustment for those who have lived independently their whole lives. Before making the move, consider, will you feel at home in a nursing facility? Because feeling comfortable in your living space is a key factor in maintaining happiness and well-being. Loss of purpose and autonomy. One of the most unexpected challenges of moving into a nursing home is the loss of purpose. At home, people have daily routines, watering the plants, cooking meals, or taking care of small tasks. These little activities give life meaning. In a nursing home, most of these responsibilities disappear. Meals are prepared, laundry is done, and even simple chores are handled by staff. While this may seem like a relief at first, it can lead to boredom, a sense of uselessness, and even depression. Many residents feel like they are just waiting for meals, waiting for visitors, waiting for time to pass. Without meaningful activities, the mind slows down and the body follows. Even those who were once active and engaged may find themselves losing motivation over time. If you're considering a nursing home, ask yourself, what gives your life meaning? Because once you move in, finding a new sense of purpose isn't always easy. Alternative options. A nursing home is not the only choice when an elderly person needs care. In fact, there are many alternatives that allow seniors to receive support while maintaining independence, social connections, and a higher quality of life. One of the most common options is in-home care, where a caregiver or family member assists with daily tasks. This allows elderly individuals to remain in their familiar environment while still getting the help they need. Professional home care services can provide assistance with medical needs, household chores, and personal care. Another option is shared housing for seniors, where a small group of elderly people live together in a home-like setting. This provides companionship while still allowing for personal freedom. Additionally, senior community centers offer daytime activities, exercise programs, and social events, keeping older adults active and engaged without requiring a permanent move. No matter which option you choose, the key is to find a solution that provides the right balance of support, independence, and happiness. Instead of seeing a nursing home as the only choice, consider other flexible options that may be a better fit. Deciding whether to move into a nursing home is an important life choice. There is no absolute right or wrong answer, only what works best for each individual. The most important thing is to think carefully, consider all options, and ensure that the decision aligns with personal needs and desires. No matter where you live, quality of life, social connections, and a sense of purpose are the most important. The key is to find an environment where you feel comfortable, respected, and valued. Whether it's staying at home with family support, hiring in-home caregivers, or exploring senior communities, the right choice is the one that allows you to live with freedom, dignity, and happiness. We hope this video has provided valuable insights into this important decision. If you found this content helpful, please support the channel by liking, sharing, and subscribing. Your support helps us continue creating meaningful content about life, wisdom, and well-being. Thank you for watching, and we look forward to seeing you in our next video.